How do Medicare broker commissions affect your Medicare experience? There's been a couple shakeups in this industry. We're going to be diving deep into what you should expect as a Medicare enrollee as different types of Medicare plans potentially become non-commissionable to independent agents. This video is going to have a lot of great information. I think you're going to love it. It's only going to take about 5 or 10 minutes, and we're going to talk about what types of Medicare plans are slowly losing their commissions. You're going to understand how the entire Medicare broker ecosystem works, and most importantly, we're going to tie this all together as to how this affects your overall Medicare experience as someone who is on Medicare and what you can expect year over year. The story begins in August or September of 2024 when many insurance carriers came out and said our Medicare Part D standalone drug plans were not going to have commissions anymore. Now, this wasn't just new plans that were signed up, it was also legacy business, renewal business, the kind of thing that incentivized brokers to keep people in a particular plan year over year. Now, this was a huge deal because we find as independent brokers, Medicare Part D is the most complicated and hard to understand part of Medicare for most of our clients. Even when we give people a full evaluation on how Part D works, they can still get confused on why their drug prices are fluctuating, why it seems to cost them different amounts of money at different parts of the year. You have to understand preferred pharmacies versus standard pharmacies. You have to understand tier structures. You have to understand prior authorizations. It's really hard for people to understand their standalone Part D plans in many cases. And that's why they often turn to independent brokers like the people here at NJ Life and Health to help guide them through the process, because they want to know that they're not going to have any surprises and that they have the lowest possible cost for their particular prescriptions. Unfortunately, that incentive for local insurance brokers and, all Medicare brokers in general actually was by and large taken away. Now, we still want to do the right thing and make sure that people are taken care of, so we did still help people with these plans. Then in the middle of annual enrollment or right before it, many insurance carriers also said, hey, we're not going to pay for specific Medicare Advantage plans anymore. And the reason is a little bit interesting. Due to regulatory pressures that I can't really dive all the way into, I'm going to try to simplify this as much as possible. Year over year, insurance companies want to phase out certain Medicare Advantage plans, but if they outright cancel them, they can face some interesting consequences they may not want to deal with. They could lose a lot of clients. Clients could get put into other plans they don't necessarily want. So rather than outright delete a plan or say nobody can take it, it's gone, what they do is they incentivize people not to take it. And in a lot of cases, that's by telling brokers like us, you're not going to get paid if you put people into the specific plan. They also take them off of certain softwares that brokers use to sign people up for, so it's not even an option on the broker side. And it really complicates things because maybe that particular plan is the best plan for somebody, and the insurance company is saying, we don't want anybody to be in this plan. And you think, well, again, as an independent broker, we're doing this person a solid and it's the right thing and we're going to do it, but you're still disincentivized to not want to do it. So it's very frustrating when the right thing often doesn't lead to any sort of compensation. Now, we were hoping this would be the end of it, but unfortunately, this trend of Part D plans no longer paying commissions and more Medicare Advantage plans not paying commissions has continued into 2025. A few companies were still paying Part D commissions at the end of last year. A few of them are now not doing that. We've also seen more and more Medicare Advantage plans that insurance carriers don't want people to sign up for also not get commission status as well. This trend is only accelerating, meaning that independent insurance agencies and Medicare brokers and all these different places are facing more pressure due to a lack of compensation. So you might be wondering how this all ties in, and I'm going to explain how the Medicare insurance broker industry works before I dive into how this directly affects you. So stay with me. Here's you, the Medicare enrollee, and then there's us, the Medicare broker here at NJ Life and Health. There's obviously other options, but we'd love to work with you. And this is how the entire ecosystem works. You, the Medicare enrollee, give us your trust and your business, right? So you're trusting us to help you pick the best Medicare plan. And in return, we give you a Medicare education and ongoing customer service related to the policy that we sell you. So this is a great system right here. And most importantly, you can see no money is transferring. So you're able to get great customer service and an education from someone that you trust, and you don't even have to pay that person. Now, the back end to that is that us Medicare brokers send new business to insurance carriers. This giant skyscraper here is to represent the big insurance carrier corporations. So we give them new business and they give us monetary commissions. So the insurance companies incentivize us, Medicare brokers, to give you this no-cost service and to give you this ongoing customer service because we are giving them new business. And it's a great system that a lot of people like. And even if you don't want to take my word for it, here's some concrete studies that have been done. So Kaiser Family Foundation, if you don't know, is an amazing research organization. They have found that health insurance brokers have a 92% approval rating. I doubt you're going to find another profession that has such a high approval rating, or if you do, it's going to be a good one. But you can see that people really trust their insurance brokers. And I think a bit of a case study too is that when they first rolled out healthcare.gov, otherwise known as the Affordable Care Act, Obamacare, whatever you want to call it, all these health insurance marketplace plans, the whole goal of healthcare.gov was that you could sign up yourself. You didn't have to go through a broker. You could cut out the middleman. In 2016, they found that 43% of people who used healthcare.gov, aka the Affordable Care Act, did so with the help of a broker. So it was a very low percentage, relatively speaking. And they found that 8 years later, 78% of people use the broker. We can kind of see that the market reacted and that most people want some sort of broker to help them with their health insurance. And I personally believe that it's because it's such a complicated, convoluted system that people need someone to rely on. There's a lot of very technical jargon. People want to make sure their doctors are covered. They're not going to get hit with these massive hospital bills. They don't want to deal with a ton of denials for their health care. They want to make sure their prescriptions are covered. They want to make sure they get extra benefits. This is so much stuff to manage, and it's so important that people want to be able to rely on an expert they can trust. And I think that's why we have to worry about the fact that many independent brokers and just brokers in general, who, as we can see, are very trusted, are slowly not getting compensated as much as they used to, or losing certain compensation categories that keep them there. So just to summarize here, starting last year, a lot of big name insurance carriers started to cut commissions or outright get rid of commissions for Medicare brokers who helped people sign up for Medicare Part D plans. So they were no longer getting compensated. On top of that, due to regulatory pressures, a lot of insurance carriers also disincentivized enrollments into certain Medicare Advantage plans by removing commissions on these specific Medicare Advantage plans. Now, you might be wondering, this is the most important part, how does this affect you? Well, there's three big things we're going to have to focus on. The first is you may be getting pushed into a Medicare plan that isn't best for you, but does make a broker money. I mean, here at NJ Life and Health, we are straight shooters. If we are not getting paid on a plan, we usually tell somebody just to let them know, hey, we are doing what's right for you. We are happy to put you in the right plan. We just want to let you know that we are not getting paid. Now, we do this primarily to let people know that we are here to help them and we want to do right by them, and that, you know, whether it's signing people up for state assistance programs or putting people into guaranteed issue Medicare supplements that have no or very low commissions, we want to do what's best for our clients, and we just hope that they pay it forward with a referral or something in the future. And that ethos has really guided us as a company, and it's really helped us grow. The issue is not everybody in this space is that ethical, and many people are just looking to, you know, sign up as many people as possible for the highest commission possible. They're looking to get a sale as opposed to forming a relationship where someone can trust you and understand that you have their best interest. So just know it's very possible that if you're in a certain type of Medicare plan, a broker might try to call you, hyping up a plan, and then if they're not getting paid for whatever you're currently in or what you actually want, they may try to steer you away from it. The second part is your independent broker or your broker in general may get squeezed out of the market. Any local business is going to have to keep the lights on, and it's very important to know that if these commissions keep getting taken away, it can be hard for them to stay open. So just think about that. If you can, work with local brokers, support them, let them know that you appreciate them and send them business. The third issue is you might have to deal with call centers more, or you might have to deal with more direct communication with your insurance carrier. Now, in a lot of cases, independent brokers like us act as de facto customer service. We find most of our clients want to call us instead of the insurance carrier they signed up with for a couple of different different reasons. One, we probably have a great relationship with them and we have a multi-year understanding of what that person's going through, what their prescriptions are, what their doctors are, what they're looking for with their coverage. And we also have all the information about their coverage so we can very quickly answer any problems. That's kind of the opposite of what people deal with often with their actual insurance carrier, which is potentially very long holds, potentially getting transferred around to a bunch of different people that are going to give you different answers and kind of pass the buck on to the next one. And also this idea of overseas call centers. Now, I never want anybody to get it twisted. I feel for the people who work at these call centers because in many cases they work very long hours for very low pay, but there is a lot of turnover. There can be some communication misunderstandings. It's very technical knowledge. So if somebody's just learning all this stuff and they suddenly have to take on these very serious calls, it can be a lot for that person and it can be very overwhelming. So we find a lot of clients are just seeing more and more insurance carriers are kind of offshoring their customer service, and it adds another layer of complexity and confusion and really frustrates people because these are very serious questions. These are things like, why did I have this crazy bill? My doctor left the network. What do I do? Why am I suddenly paying more for my prescriptions? And all these things are usually very easy questions to answer, but if you wait on hold for 45 minutes and then get sent to somebody in a different country who might not totally understand how the system works, it can be frustrating and only add to the stress. So we find that we are a great way for people to get the answers to the questions that they have in a quick and concise manner. So we want to ask you, what do you think about all this? Please leave us a comment below. We'd love to hear your thoughts. Do you like working with your Medicare broker? Have you switched Medicare brokers? Do you want to just call the insurance company direct and not deal with anything? Please let us know about what you think about all this in terms of the commissions going away on specific types of products. And if you want to work with local Medicare brokers who really have your best interests at heart, you should work with us here at NJ Life and Health. We are licensed in 29 different states. New Jersey will always be our backyard, but we are happy to help you with anything that you need related to Medicare and in most cases life insurance. We are starting to expand into marketplace plans like the ACA into New Jersey as well. So we want to be your one-stop shop. Like I said, we're a local family-owned business. We've helped thousands of people just like you with their health insurance, and we want to help you as well. We're going to give you a one-on-one call with one of our brokers who's been doing it for a very long time, helped hundreds of people, and they're going to work with you for life to make sure no matter what happens, if you move, if you have a change of health, if you have a change of finances, that every single year you're getting the care that you deserve. So please reach out to us at 848-226-6897 to schedule your call, or you can visit our website at www.njlifeandhealth.com. Hope you guys enjoyed this video. Let us know in the comments below, like and subscribe, and we will see you in the next one.